Awesome. So yeah, we've been training all week. Josh and I here in Arizona, Phoenix, Arizona. We were at Gustavo Dantas's school. This marks the first time in 26 months since I had my stroke. Josh, this is what, your 10th month?
10th month, yeah.
So 26 months, 10 months. This is the first time I've ever trained outside of my academy at another academy. What about you? Have you trained anywhere else?
Nope, that was just it.
So this is the first time for both of us. I will say, I know when I rolled with other people, just let them know we were doing the back drills and stuff. One guy said, I'm like, listen, I'll tap. I'm like, but I have a stint in my neck, had a stroke. Oh, he was like, okay. And, I had no issues. And then Issa, that black belt I rolled with, I didn't get killed.
Like he had with him.
Yeah, he had chances.
With a couple other blacks, but.
Yeah, he kept attacking, but every time he got close to my neck, he transitioned to an armbar.
Yeah,
so,
I feel like the black belts were very respectable on our necks because of our history.
Yeah.
As y'all know, like we both had a dissection in our. He had a carotid dissection. I had a vertebral artery dissection. But yeah, like I rolled with Gustavo Dantas. Yeah. He's a beast. Yeah, and then all of it. It seemed like all of his kids, all of the from blue to friggin' black, they were all beastly.
Yeah, and they were controlled. I didn't have any issues.
Yeah,
I never felt like super anxiety from training. But let's talk about. So that's good. So we both hit. That was a. What do you call it? A milestone for us to be able to go out and roll somewhere else without too much anxiety. So that was positive. But let's talk about the coaches convention for Arizona. We both did a speech, just letting them know the dangers of.
And it's going to be posted.
Yeah, it'll be posted already. The couple guys that we spoke with, they never knew that something like this could happen. One guy was actually there at the conference, was invited specifically because he was having some issues as well, right?
Yeah. So it sounds like, it's always concerning for stroke, but in his case, it could have been other issues, but definitely probably should get a better workup than what he did, because what we're seeing is a lot of people are missing it in the emergency room.
That's what I want to make sure that we catch on today. Touch on.
I feel like all of the topics were really all had something to do with strokes.
Yeah.
I mean,
brains.
Yeah, I wouldn't mind touching on each of those topics, because the first one was about PTSD. Yeah. I don't know about you, but like after my stroke, I felt like it took a little bit out of me. I felt handicapped to the point where I felt like I couldn't protect my family if something came down to it. But getting back on the mats definitely helps, and then helps you kind of realize all that training, even post-stroke, still is effective, And then so I enjoyed it. Chad's PTSD. So there's studies coming out saying like Jiu Jitsu helps with post-traumatic stress, but the talk from Chad, it was about PTSD and what to look out for, and kind of being a support role and kind of recognizing that amongst your students and reaching out to them if you see any kind of concern that they're distancing themselves and whatnot. Is that how you felt?
Yeah. Mm-hmm. And then Jared talked about concussions.
Yeah. And that overlaps a lot.
That overlaps because it's the brain.
It's a brain injury.
And I think the takeaway from the conference for anybody who sat in on there is, the delicacy of the brain, the neck, and us not being so stubborn when it comes to getting checked out.
Yeah.
Because especially with the stroke, you only have, like we said before, you only have a few hours.
4 hours, yeah.
So the other thing I want to talk on today while you're here is the more that I research the subject, and you as well, it sounds like a lot of these strokes from jiu-jitsu are coming from a tear in the carotid or the vertebral.
Yeah.
Now,
I think we're seeing like 80% of them in our research.
Right. So how many people, how many on our research, how many on the spreadsheet, how many cases have we to date found people with strokes from jiu-jitsu? About 60?
About 60.
Yeah.
So in the medical community, they only have 2 documented cases in journal articles, which is a problem in my opinion, because I've worked emergency medicine for over 10 years, and it's highly missed, especially in young, healthy people in shape. A lot of times they think it's dehydration unless there's like really clear visual stroke, like the facial droop, the unilateral weakness on one side of the body, the slurring of the speech. But other than that, like especially with the vertebrals, they get missed a lot. So I think one of our things about coming out to the conference, besides raising awareness to the jiu-jitsu players, is big time like letting the coaches and gym owners know about it, because since they only have 4 hours to get the TPA, which is pretty much liquefies clots to kind of prevent brain tissue damage, and recognizing it, what we're seeing a lot of these cases is people are going home not thinking it's much of anything, and coaches and gym owners are letting them go home, which is, I think, is a big issue.
It's like a big mix. They just don't know.
Yeah, they just don't know, and that's why the coaches and gym owners probably the biggest people that need the awareness.
Yeah.
Yeah.
So the more I dig into the research as well is, and what we talked about at the conference, was the advocacy of the coaches. So once the coaches are aware that strokes can exist from the jiu-jitsu sport, choking and whatnot, okay, great. If we identify that one of our students is having these signs, okay, great, we're going to get them to the doctor right away. So let's say they listen to us and they understand the dangers, they get people to the doctor. But then it brings a whole nother issue to the table, is that most of these dissections are misdiagnosed.
Yeah, a lot of them are.
A lot of them, and it's not just from jiu-jitsu. So we're both in groups online, young stroke survivor groups, and if it seems like you and I are like lurkers, like on those sites.
On all of them. I'm even in the carotid dissection, even though mine was a vertebral. I think one of the questions is, did you have a carotid dissection? I put yes, but mine was vertebral.
Whatever.
So.
But
it overlaps.
It does overlap. But we're both on there because I know I'm on there because I'm looking to see similar accidents, similar injuries, seeing how much people are being misdiagnosed. And what I'm seeing is a lot of people are misdiagnosed and being sent home from the ER. We've had a couple cases documented already where somebody actually went into the ER, but then the ER sent them home because they didn't do the right imaging.
Yeah.
So let's talk about the imaging.
That's not some cases. That's a lot of
Most
cases.
of them. And again, this is not just coming from jiu-jitsu. There's a serious disconnect when it comes to these types of signs with a dissection. Then they go and get the imaging, and a lot of times the imaging is being missed. Yours was missed the first time.
Mine was missed, even though like I've worked in emergency medicine, and I've known that dissections could be an issue in jiu-jitsu just because of the torquing of the neck. So whenever I got to the hospital, I'm like, I was I was for sure I was dehydrated, but like if I was seeing myself as a patient, yeah, it didn't seem like dehydration, the dizziness, and yeah, whenever I went in, I seen one of my fellow colleagues from another hospital, and I was like, yeah, I think I'm dehydrated, but I'm concerned about a dissection. She was concerned too. I went to another side of the ER, did the whole proper workup, but misread by the radiologist.
Yeah.
Yeah. So
what are the if I'm a radiologist, what do I need to be looking for?
So tears in the carotid, tears in the vertebral arteries.
CT scans with or without contrast?
With contrast.
So that's where I've been reading a lot. A lot of these CT scans without contrast are not picking up the dissections.
Yeah, especially the vertebral. So MRIs, or specifically MRAs.
What's the difference between MRA and MRI?
So MRA is with contrast, so it looks more at the blood vessels. It's better at seeing the vascular part. So if you're looking at like cancers, which are vascular, arteries, and we like you get better imaging with the contrast. Now with that said, carotid's a little bit easier to pick up on MRA, but it's only a 20% chance of picking it up on the vertebral. But CT scan, because it's a lot more sensitive and better at examining those vessels, it goes up to 90%. So it's still a chance of being missed 10% of the time. So the best thing is a carotid or vertebral angiogram, which involves like a catheter in the femoral.
What's that?
So it's pretty much a little camera like on a wire that they kind of go up and examine your carotids and vertebral arteries, but that also puts people at risk for dissections and strokes.
What do you mean?
It's rare, but it's a lot more
what do you mean it
invasive.
That's the
the
image
diagnosis has its risk for strokes and dissections as well. So the recommendation is a CT scan, really.
With contrast. With contrast
of the head and neck. So that's going to check for posterior circulation issues in the brain, as well as neck dissections. And the thing about CT scans, so everybody wants to do a CT without contrast.
Why?
Because
less expensive.
Well, it's a quick test, and whenever it's in the setting of a stroke, you could pick up some strokes. So in the ER, you're not going to do an MRI because you're not going to leave someone on a table for 45 minutes not getting any medical treatment, trying to dictate if we can give them TPA or not. The CT scan, though, without contrast, has faults of its own. So if it's not clear, if it's a stroke, sometimes it'll be missed. So young, healthy people with a normal CT scan, that gives people comfort when a lot of times it shouldn't, because it's commonly not seen on CT scan the first 12 hours. So the CT scan is really to recognize if this is a hemorrhagic stroke, but it's not conclusive for an ischemic stroke, which is the majority of them. So if there's concern about a stroke, TPA is the go-to. If it's still being worked up and kind of iffy, at least get it admitted for an MRI if it's really a concern. Yeah, so the first visit for me at the hospital, they probably should have admitted me for an MRI if they didn't realize that I didn't have a stroke, or if they thought I didn't have a stroke and they thought I didn't have a dissection. So they probably should have admitted me. Yeah. Which I'm trying to change with emergency medicine docs. So as soon as they hear chokes in Jiu Jitsu, automatically think dissection, automatically think stroke, and if all of that looks normal and no huge defects, or if they're getting better, probably still should be consider admission into the hospital for an MRI, just make sure there was no stroke.
And then from the onset of, a lot of these people, like for example, Allison.
Yeah.
She started noticing signs.
Yeah. And the paramedics, like first.
Yeah.
Yeah, they said she was probably dehydrated or something and didn't recognize a stroke. So it kind of starts from the outside. I mean, the coach's perspective are missing them, the paramedics are missing them, and then we're like the positions I am like seeing patients, we're missing them. So neurologists are missing them.
Yeah, that's the scary thing about this is that it seems as if it's not just in jiu-jitsu either. Like you said, in our support groups, there's a lot of young, healthy people that I'm seeing.
Yeah,
a lot of females especially, which is odd. I don't know if that's just because they're more open about what's going on.
Maybe not. Maybe because they don't have as much muscle. Or muscle tone in their necks. I don't know. It's kind of interesting. I'm not quite sure.
The
age does have a
effect. It seems like
factor.
What's our numbers seem like?
So what our numbers is around like 37. What we're seeing with dissections in jiu-jitsu.
I was 39 when I had mine.
Yeah, I was 38. The median ages, or in dissections though, in the medical community is about 37 to 41, but we're seeing them as young as like 25 in jiu-jitsu, but definitely over 30 is the majority of them, like the 25-year-old and possibly that 18-year-old from the Brazil. Those are definitely outliers, but definitely my suggestion is over 30, definitely got to watch out for them.
I've reached out to let's go back to the Brazil. Ronaldo is
Ronaldo
19.
Silva.
Yeah, Ronaldo Silva, 19 years old, purple belt Abu Dhabi champion, premier shape. Doctors have no idea what happened to him. I just reached out to them last week. Doctors, I said, what's going on? We don't know.
Yeah.
Now, you said he was doing...
it sounds like he was doing grip training on the pull-up
bar,
which could kind of twist the neck to the point where people do dissect sometimes.
Or he had a dissection already, right?
He could already had a dissection, and whenever he twisted his neck or looking up, it just released that clot. I don't know. Could be. The chances of it being a dissection is high.
So the purpose of this journey to Arizona was to start with the Arizona coaches, and I think we made a good dent. Like you said, we're going to be posting that video, and we need to get in front of more coaches. And I think we need to go out and speak to these coaches. We need to. Coaches need to have probably have some type of system in place. Not only like you were saying in our talk, was coaches need to have a poster on the wall. Just some type of details.
Like a BFAST poster.
BFAST poster. Coaches should know the best neuro facilities. Around their gym, because
the stroke centers.
If I would have been able to communicate, I would have just told them to take me to the closest hospital, because I know nothing about. But luckily, they knew to take me to a different hospital that Freighter in Milwaukee is one of the best neuro hospitals around. Luckily, they were able to save my life. When I did the interview with Jason and Kate, they were the paramedics were actually asking Jason, where should we take you? And none of these patients are going to have any idea.
They don't get it. They don't get that
So
they're stroking out.
Yeah, they don't. You don't know. I didn't know. You didn't know. So Jason didn't. Nobody knows. So the coaches need to have. Okay, we know that this is where our academy is located, and these two hospitals are the best for neuro. So when your student is dizzy, vertigo, laying on the mat, things are dizzy, weird things going on with their vision, sounds, droopy face, blurry vision, and
especially dizziness that doesn't get better. Whenever they're laying down.
That's what we're hearing.
Yeah. The dizziness, if it's true dehydration, if they're laying on their back and the blood flow's getting in their brain, the dizziness should get better.
Yeah.
Yeah.
And that's not, and that sounds like it's not happening.
And that wasn't getting better for me. And I mean, sometimes emergency room providers are the worst patients for themselves, but which I think was a case for me too, until I kind of mentioned a dissection at the hospital, but I was almost for sure it was dehydration but
now looking back,
but everybody thinks it's dehydration.
Yeah.
Especially with these cerebellar.
Have you ever been dehydrated?
Yeah.
Yeah.
Totally did not feel that way.
Yeah, I agree.
Yeah. But yeah, I think part of our talk, besides raising awareness, is like creating advocates, especially with the coaches and gym owners. And my recommendation for coaches and gym owners, because the medical community is failing us so much in the jiu-jitsu community, as well as other communities, but definitely in the jiu-jitsu.
Because they don't know. I think it's because they don't know what a jiu-jitsu is.
They think it's like karate or something like of that nature. They don't think it's a lot of chokes, a lot of neck manipulations, cranks. But like my recommendation to be an advocate for your students, go to the hospital with them. Yeah, don't just
drop them off.
Drop them off, or let them like
figure it out.
Figure out for themselves. A lot of times they're going home. Teammates are carrying them to their cars and driving them home and leaving them on their recliners, and then saying, "Call me if you need me." But they should be
Chris Leaves' story, if you want to reference.
You should either be driving them to the hospital, but my recommendation is just call an ambulance if it's a high concern.
It's pretty simple. I mean, that emergency doctor that sent me that email out one day, who said, I'm an emergency doctor, just started jiu-jitsu, got guillotined for the first time, and
which we're seeing a lot of guillotines causing them.
Yeah, started making me think, could this cause a dissection? Yes, it can.
Yeah, definitely.
Because of that, this is why the coaches need to have this education, and that's where Josh and I have been spending a lot of time and energy building the spreadsheets, doing the interviews. Our spreadsheets will show who it is, when it happened, how old they were, what their belt was when it happened to them, how long had they been training for, who was the size and the color belt that put the choke on, what was the type of choke, was it carotid or was it vertebral, was it missed in the ER? That's as extensive as our report is.
And I don't want to like glaze over other ones that aren't vertebral, because those are issues too. It's not as like big, but sometimes it could be cardiac with septal defects, so holes. Sometimes with our buddy here in Gilbert, Arizona, his was most likely atrial fibrillation, which is an arrhythmia of the heart that kind of quivers the heart, that causes the blood not to circulate properly and can cause a clot that goes straight to the brain. Sometimes, we're seeing a few autoimmune issues that are causing them, but again, most are dissections.
Yeah.
80%.
Yeah, 80%. So our list is still building. Hopefully, there are some people I also know that haven't reached out to us yet, but I know that they are out there and they've had similar dissections or strokes, and they're not even participating in jiu-jitsu
Contact
anymore.
us if this happened to you.
Yeah, please, because we'll keep it confidential if that's what you would like. But we need to have this data so that we are presenting this to the medical professional, that industry.
We need to, I think that's, I know that like it's my goal, but I mean, you're kind of grandfathered into my goal.
Yeah,
because we are collecting that data together. Yeah. But yeah, the medical community needs to know. I mean, again, they're failing us, and I mean, like what I was talking about being an advocate is coaches go to the hospital, ask those questions. Could this be a stroke? Could there be an artery tear in their neck? We've heard this talk. We know it's a growing issue.
That's exactly right.
Yeah, ask those questions, because a lot of times they're not thinking dissection or stroke. They're just thinking of dehydration, viral syndromes. Ask those questions.
Yeah.
Go with your students.
And as a medical professional, we hope that you take this information from us and step back and reevaluate. This could, not even just the medical professionals, but I hate to say it, coaches too, there is a liability issue here if you're missing malpractice, if you're missing this type of stuff and somebody dies, or even the case of, like you said in the talk, Sean Eston, who his family sued the gym while he was recovering from a stroke from a rear naked choke.
I don't think anything came out of it, but it does put people at risk, especially if they don't act accordingly.
Right. Most gyms are, it's just due diligence. I don't know what the football community does. I mean, we know football causes concussions, right?
One of the things that, especially Little League, I mean, football is really getting it, or they're really noticing the concussion. As soon as they notice a hard hit, they're pulling them out of the game. That's not how it was 10 years ago. I was at my son's soccer game, and someone kicked the ball, hit this kid in the head, and he was just holding his head and doing this number, and they kept him in the game. So the football community is actually getting more keen on picking up those concussions, but a lot of the other sports aren't.
Okay. Yeah, the brain's fragile.
Yeah, and if you do have a concussion, recommendation is if you do get hit, dark room, no loud noises, no bright lights for 2 to 5 days. No physical activity, especially anything you're able to get anything that's going to cause head trauma, and not going back to physical training at least 1 week after the symptoms go away, which sometimes they have a little kind of overlap with these stroke symptoms. So my recommendations for head injuries, just go get it checked out.
And that brings us to another. It's
which can cause dissections too, with the blunt trauma and whipping the head back. I mean, it's still like can twist the neck and cause strokes, not just these little concussions, which are kind of micro bleeds.
It's certainly. I'm certainly happy to be able to come out here and
finally meet
coming
each
out.
other.
We got to roll. He was gonna go neon.
Met Andrew Locke.
He was gonna neon face me yesterday, but he decided that I had a stint, so he decided.
Yeah, I think it was in your left, right?
It was.
I was about to put it on, like, put some pressure on that neck, and then I had to readjust. But that's another thing about like jiu-jitsu players. I mean, like, talk to your partners about your injuries.
I think
a lot of us are meatheads. You know?
We are. That's the biggest thing. I think if you ask me where I see the sport in 10 years, if we keep going at the pace that we're going right now, Josh, I think that we're going to have a list of hundreds if there's no
Strokes
change
and-
from strokes,
Yeah.
concussions, and death. If there's no awareness, I
Yeah.
think. But if people take it seriously, I did get it. Like I said, I got an email. You saw that email I got as we landed here in Phoenix. I showed Josh an email. I'm like, look at, I just got this email, and it was a gentleman. Hey, I'm a blue belt in jiu-jitsu. Read your articles. I got a wife and 2 kids at home, and I'm gonna tell you right now. Since I started reading your articles, I'm tapping to bow and arrows.
And yeah, I am too.
Yeah,
You know, like
I am too.
Blue belts.
Yeah, I don't
blue
care
belts
anymore.
doesn't
Yeah.
matter.
Yeah.
Yeah. If
The minute they, like, we were playing it back, the guy got here yesterday on me,
Yeah.
and you know, usually you can kind of fight out of it.
Yeah.
But they had that grip on the. I don't even need
Yeah.
to just.
And especially because mine is so fresh still that like people would like try to grab my neck and I tap and then they're like, oh, what happened? And
You.
I mean that's okay,
Yeah,
you know.
it is okay.
Don't have that ego.
Yeah.
I mean going on like this data that we're kind of seeing though is it can happen to anybody, and
Yeah.
we're seeing a lot of white belts getting it done to them. And my assumption is because they're just getting choked more. But
And they're probably stubborn.
and we're seeing like 40% of them, like almost 20% brown, almost 20% black,
Yeah.
being the choker,
Yeah.
which is kind of concerning because in jiu-jitsu you always say, don't go with I only go with the white belt. I want to get hurt, but
Well, do you know what Joe? Do you remember Joe Rogan? What his
Yeah.
quote is? He said, this is like 4 years ago, but it's still out there. He goes, "Find a blue belt." He said, you take your blue belts and you just beat the fucking piss out of them. That's what he said. And you know, yeah, to a certain extent, but
Yeah.
I mean, if you know, choking the shit out of them and stuff like that, like.
I think you're trying to break egos to, I mean, like they get better whenever their ego gets broken pretty much. So I think
Which is true.
that's part of people's thinking. If they have some guy like being dirty and not being super technical and
Which is mostly white
being a
belts.
bully. Yeah.
I mean, I hate to say it, but I was thinking the other day, would jiu-jitsu be as fun if you took the chokes out of the equation? And I think a lot of people are going to say no, but here's what I would say. I would say step back for a second and picture yourself as that white belt.
Yeah.
And then picture yourself as that blue belt. When we were there, for me, that was the most addicting time of my life. White and blue, right?
Yeah.
So that's when we loved
White,
it the
blue,
most.
purple.
We loved it the most. At that time, we weren't the ones on top, always dominating, always choking.
Yeah.
We were usually the ones
Getting joked.
getting choked. But a lot of that white belt, blue belt is learning how to establish positions and transitions before the
And
submission.
defense.
Yeah, and that was
Defending
fun.
the
And that was the funnest time for me. I'm not saying that we're going to go away from the strokes, and I'm not saying that's ever going to happen. What I'm saying is that because I do have a lot of people, what's training going to be like post-stroke?
Yeah.
I'm telling you right now, it's just as good.
Yeah.
But you have to have that mentality. It's hard at first. I know, Josh. It was hard for you
It's
to
still
not be
hard,
that
yeah.
alpha in the room. Always win. Always win. Same with me. Always win. And then to then all of a sudden you have this accident, and now you're just another guy, and you have to tap. You're not as aggressive and whatnot.
I think one of the things that I found beneficial though, since I've been doing jiu-jitsu so long, it's easier for me to kind of work with most people in the gym not getting in those positions rather than someone like a white belt that it happens to.
Yeah, and that's it. I mean, like I was saying to you, it's like there's a sense of urgency now when you're training as well. Like in the past, I let guys get grips. Oh, it's not deep enough.
Yeah.
You know, I'll let you play, or I'll let you get that choke.
You let them get in and
Yeah.
try to defend
Yeah.
whenever it's
You just can't do
in.
that.
You try to go to the last point and
Yeah.
be able to get comfortable to defend out of it.
Yeah.
I mean, John Fitch, my old teammate, that was his MO. Like he would begin choked the crap out of, but he wouldn't tap because he had so much muscle in his neck and was able to get that chin down. And
that's what Jason, who we just did that interview with him in the hospital. He's got his skull cut open.
Yeah.
And he was literally telling me, Chris, that was my game. He's like, I was the guy that nobody could choke me. I get out of anything. And there's guys in my gym like that. It makes me cringe. I also have to make that choice. Do I want to keep pulling, or if he's going to be that stubborn, is it his fault, or is it his fault that he's that stubborn? Well, yeah, it is. But if I have that awareness of the fact that I could do damage to his carotids, you know, Issa, the black belt at Gustavo's, I said to him, I'm like, man, thank you. I said, I'm like, he got me in like a triangle twice and transitioned it to an arm bar.
Yeah. I know, and Gustavo was about to get a
he did
triangle,
the same thing.
and then he transitioned
To an arm bar?
Yeah.
Or what?
Well, Gustavo's game is triangles, you know, so.
Is that right?
Yeah, that's what he's known for.
So, I mean, they're there and they're transitioning, so, you know, let that be. You know, if you know you can finish that, like he could have finished that triangle on me.
Yeah.
I wasn't going to fight out of it, but at the same time, like he still kept moving.
Yeah.
And that turned into an arm bar. And then I thought he was going to omoplata me, but then it turned into an arm bar. So, you know, I think that's the evolution of where we're going with the sport.
What do you think about, like, well, I think there's different levels of training against the people in your studios. Like, there's the competitors.
Right.
I think they're more likely to understand the risks, and
The competitors?
they're more likely to take the chance. But an average guy just doing jiu-jitsu for physical fitness, self-defense, I feel like they can, I mean, they can minimize that. They can tap early, because I mean, really, if you're not going to be in a competition where they're cranking on it, what's the point? Yeah.
Yeah, and that's I think that's where we got to go with the sport. Most of the people on the mats these days are that blue belt with the two kids at home.
Yeah.
You know?
And the competitors going against the guys that aren't the competitors understand that you're putting them at risk whenever you're attacking that neck so vigorously.
Yeah. Awesome, man. Well, thanks for coming out.
Yeah, I think that just kind of recap, coaches and everybody, especially with these dissections, since they're the most prominent, is risk factors over 30. Also, like, we've been noticing 40% of them have been sick the week before, which is, I mean, like, if you look up in the medical community, even though people don't know still, is sometimes sickness can play a role in those artery tears. So sick the week before. If they're sick, I would suggest, like, taking it easy for a month afterwards, especially if you're over 30.
Yeah.
But doesn't matter.
That's the whole thing. Just listen to your body, man.
Yeah.
I mean, you know, I think my massive stroke would have been avoided if I would have just said, you know what, something's not right. I mean, I know it, a lot of the time too. I think a lot of these carotid and artery tears, they will repair themselves on their own. So even if you don't go in and get the imaging or whatnot, and I'm not suggesting that by any means, but I'm sure that it's happened. I've read some Reddit articles where guys were like, I'm pretty sure I had a stroke.
Yeah.
Or a tear or something, but, you know, they never got checked out. You know, it sounds like a lot of these accidents, they can heal up on their own.
Yeah.
But that's the point. Like, sometimes you need to listen to your body.
Yeah. And know that it doesn't matter which belt. It doesn't matter how heavy or light. We're seeing people having strokes and dissections, rolling with people a lot more heavier than them. We're seeing strokes with people like one of our buddies, like he was going against a yellow belt and he's a purple belt. So, and then he had a stroke. I mean, it just kind of shows you that it doesn't matter the size, it doesn't matter the belt. It can happen to anybody.
One of the people that we interviewed was letting a smaller female triangle him.
Yeah.
And that was the icing
Oh
on
yeah,
the cake.
and he was a pretty large individual.
He is, yeah. So it can happen to anybody. So it's just again, it's awareness, and we're gonna keep doing what we have to do.
Tap early, especially in practice.
Yeah.
Tap with cranks if they're putting pressure to turn that head. Just tap. You know, like it's pointless. You know.
It is. I mean, I'm even thinking about myself and how I've changed my training, and it's to be honest with you, Josh, I think it's taken a lot of pressure out and made it a little bit more enjoyable.
Yeah.
You know, I remember there was times where I would go home after getting tapped out, and I just so mad at myself for X, Y, or Z, and that makes no sense, and that's just the ego, obviously. But now, just being more like it's cool. I tap, you know.
Yeah.
Who cares?
Yeah.
I mean, really, who cares? And I think that's maybe bringing the fun back into jiu-jitsu for me. I don't feel that pressure, like I can't ever tap, and that's, you know, sometimes as you progress in the sport, like nobody wants to get tapped out. Browns and purples and blacks don't want to get tapped by blue, but man, things are changing too, and blue belts aren't made the way they used to be. You know what I mean? Like
evolution.
So man,
blues are now the blacks of the old days.
Yeah, no shit. It's true. So yeah, awesome, man.
Yeah. All right. Well, yeah, it was nice being here with you, and I mean, hopefully, if you want to bring us out to in schools or whatever,
let us know.
Let us know. I mean, preferably, Arizona had a coaches conference that was open to all the coaches and owners of in the Brazilian Jiu-Jitsu academies in Arizona. Establish those because we can spread awareness of multiple issues, you know.
Yeah, absolutely.
And help each other,
Yeah.
like businesses and whatever. But we would love to come out and kind of spread awareness. But if you feel that's beneficial, reach out to us. You can reach out to me, Joshua Vera, on Facebook, Marine Jiu-Jitsu on Instagram.
We have a Facebook group called Strokes. What is it called again?
Strokes, vertebral and or vertebral or carotid dissections in Jiu-Jitsu survivors.
Yep.
Yeah.
Yeah. So that's on Facebook. You know, if this has happened to you, my blog on Medium is medium.com/bizjitsu. My hashtag or whatever you call it, call tag on Twitter and Instagram is bizjitsu. Chris Martin on Facebook. I'm easy to find. You just got to type in Chris Martin Strokes, and you're gonna BJJ Stroke Chris Martin. You'll find me. So, and then you'll find Josh because he's in. I talk about him in all of my.
And we're in the mix together.
Yep.
Quite a bit.
Yep. All right, man.
All right, man.
Safe travels.
Take care. See ya.